This is really bothering me. All this stuff in the background is bothering me. All right. Welcome. It's your girl Diamond here with a new Wellness Wednesday. And okay. Something's happening. I want to make sure that I'm doing this right. Oh, wait. Let me go back. Good afternoon, Lola found me. Okay. Hi. Okay, so that's working. I need to edit this. I did something right. It went in. This is totally new. Okay. Okay, I got that. I send the invite to. Sound is good. Okay. All right. That's great. Oh, I see. Okay. So everybody knows it's working. Okay. Okay. I see. When you're coming in, please hit that what's that? Hit that like button. Let's hit that like button. We are going live with our guests, as y'all can see. Let me see. How do I'm just gonna wait till she gets that and come in. Hopefully she'll come in and I can accept her. This is a new platform that we are trying to use so we can go live with our guests on YouTube. Yesterday we did a trial run, me and Pine and Ginger, and I'm excited. Welcome to Wellness Wednesday. I'm your girl Diamond. If this is your first time here, welcome. Yes.
Right? I'm, we're so used to looking dead center in our phones, and now I'm like,
oh my God. We did it! Yay! Hey, Shy.
And I parked away from everybody, but it never fails. Someone always comes to park nearby, and it's like, but why?
It's gonna be all right. Okay. So I got all this stuff, girl. I was talking to myself in the first one.
You were?
Yeah, I didn't hook up what I was supposed to hook up. Okay, let me see.
Hey, John. Hi, Miss Lola.
Oh, you can see the comments.
Yes, I have to tap and kind of like leave out of this, but I can see if I tap out. But sorry, y'all. I just want to make sure everybody sees me as clear as possible.
My hat looks dirty, like my hat.
Yeah.
All right. So I don't remember how to change the background, so screw that right now.
I don't know. I did it.
Okay, so first off, welcome everybody that's coming in. I hope that more people will see.
Raise up my car a little. It's so tiny.
And I pray that people will come in. If you're coming in, please put something in the comments to let us know that you're there. That's exciting. And just want to welcome to Wellness Wednesday, Pine and Ginger. Yay! We have been on this self-care journey for a minute, and a lot of other lives have contributed to this one. This is the one that we were supposed to have last week, where we were talking to Pine and Ginger, who is going to tell you a little bit about herself. So when she's giving you advice, she'll tell you why and how she comes up to this perspective. Because first off, this disclaimer: don't take all this information and go do this stuff and then blame us. All right? This is our own opinions.
No, we're not doing that.
Right. Okay, so welcome, Felicita. Welcome, Miss Yoli. People go out their way to park by you because they think you might be doing something wrong.
Miss Yoli, I don't know what I guess they don't want to be parked near anyone, but I mean, I don't want them next to me.
Oh Lord. Hey Sherry. Oh, everybody's finding us now. I'm so glad. I did not say Siri. All right. So I'm going to try my best to keep up with the comments. But for those of you who are new, P&G, tell them who you are. Tell them you got a channel, everything.
And yes, I do have my own YouTube channel. It is Pine and Ginger Plans on YouTube, but you will not really find anything like what you're going to get here today on my channel, just because it's separate. My real name is Siobhan, spelled S-I-O-B as in boy, H-A-N. I am a registered nurse for the last 10 years, but I've been in the medical field for, is it 16 years now? 15 or 16 years, something like that. What you're going to get here today is based on what I've been taught, what I've learned on my own, and what I've also experienced. So please, disclaimer, what I'm giving you is what works for me and what I know. However, please make sure that you are still seeing your own regular primary care doctor or a gynecologist. Hopefully everyone on here is, if you don't have a gynecologist already, you're going to get one. Make that one of your priorities for 2022, is that you have a gynecologist, because your primary care doctor is just going to give you like the brief overview of, a woman's body, female genitalia, what goes on. But your OBGYN or gynecologist hopefully will give you a more thorough, in-depth look at it, everything that's going on, and what works for you. And if you feel as though your gynecologist is not as thorough as you would like them to be, he or she, don't worry about it. You can always change, and anytime. Don't feel like you're
Don't feel like obligated to stay with that one person.
Don't feel like, oh, my insurance company may not let me change. It's not up to them. It's up
to you. That's a good point.
For Black and women of color, we are at a disadvantage. So we definitely need to make sure that we speak up and make sure that our voices and concerns are heard.
Okay. All right. So good afternoon, Atia. Hello, Shannon. Hello, Kate. Janae, welcome. Everyone that's coming in, welcome. I'm so glad that this thing went through. I think I might be doing this more often, because this is amazing. I didn't think I could go live with people on YouTube because I didn't know how to do it. Let's be honest. So first off the bat, I'm not going to try to go back to the last live we had on Instagram, but what are the key things that women should do to take care of themselves? Because suppose I'm my mama didn't tell me everything. Right. So I had to learn a few things on my own and then some, and I'm still learning. We talked about it briefly. Hello, Melissa, welcome. We talked about it briefly where in our culture, culture-wise. But realistically, what areas should we be really mostly paying attention to more? Because people talk about body odors. There could be dryness. There could be lack of elasticity. I can't even say the word. But there's things out there that we can do. I mean, growing up, first thing everybody said, you got to douche.
And that is
come to find out years later, we shouldn't be doing that, because our body produces and cleans itself. It purges itself. Well, there it is.
Yeah, so like I said before, number one, make sure that you have a well-trusted, well-informed gynecologist. Number two, make sure you are listening and paying attention to your body. So even if that means pulling out your planner and making a separate wellness section, which I know Diamond does that very well, and even make it even a subdivision if you need to. Specifically,
now what you mean by subdivision?
So a subdivision, section? A wellness section. So you have your wellness section, which is your overall body.
Okay.
Your female genitalia area,
Mhm.
you can also make that its own separate subdivision so that you're specifically focusing on that. Um,
Okay.
so, you're like keeping track of your discharge, if there is any,
Mhm.
what color, what smell, consistency, things like that. Keeping track of your cycle, and your moods and weight fluctuations as well, because that's also a part of it,
Wow.
and everything like that. And so, just so that you know, and you can see and you can have a pattern in front of you, like, all right, this
This is
is what's
happening.
going on. All right. So, for me, for instance, I know when my cycle is coming, my body is just 10 times more sensitive,
Mhm.
and like emotionally even more sensitive. So a person can say something to me, which normally I'd be like, oh, whatever. But during like the PMS stage, before the cycle comes, I'm ready to fight.
So everybody got PMS?
I would, I want to say everyone does, but
Hmm.
everyone's so different.
What's
So,
PMS?
so PMS is the premenstrual syndrome, right? So it's the characteristic or set of characteristics that's completely, individual to everyone, customized to everyone, how your body is. Where before your cycle starts, that could be 1 week or even 2 weeks before, what your body goes through because of the the changes in your
So
hormone.
moody. Like you go through
So
mood changes and stuff like that too.
some people are more moody, more emotionally sensitive, angry,
Mm-hmm.
sleepy, tired. Your appetite can increase, things like that. Some people even get headaches. It the spectrum of everything that it can be so broad because everyone's so different. So we can't all say like, oh, every woman during her PMS stage
Mm.
is ready to fight, ready to cry. She's angry. She's eating like she's been starving all her life. No, because everyone is different, and you also get cravings sometimes too.
Okay,
So
so there's questions. I'm number one. I was about to say the same thing Yoli said. First, Planet K says, "Oh my God, everyone at some degree, I get very depressed for a day during my PMS period. I hate it. I do everything to prevent it." Yoli says, "I had a hysterectomy in December 2007, and I still have phantom symptoms. Maybe because I still have my ovaries."
yes,
That's a good question because I do this. I have the same thing. I had a hysterectomy, but I'm still going through the motion.
right,
My nipples get tender. I have back pain. And those are symptoms that I know the period coming, but ain't no period coming up in here.
right.
Ain't no more. Another thing is Melissa says I'm 54. How long does PMS last usually?
PMS, like I said, it depends for everyone. It can be 2 weeks to just about a day, couple
Hmm.
hours,
It
minutes.
depends. Everyone is different. Hey, Miss
But
Washington.
this is where, keeping track of everything comes into play, because then you can start to be like, okay, well, now I know how long my PMS lasts for and when it usually starts. Can it be 1 week before or 2 weeks before?
So okay. So this is a good point then, because I thought the wellness, I just was tracking my blood sugar, my meals and stuff like this, but a more intimate tracking process can help you understand, and when you go to your doctor, know that these things are really happening. I don't understand what's going on because we as we seem to forget.
Right.
Yeah, so I don't remember that last week I was having back pain. I took 2 Tylenols, and then I'm wondering why I'm acting funny later on. But then if you look back, like you say, and keep track of this stuff, you can
Right.
get a better understanding of what, because I know food has, it contributes to it.
Mhm.
Your sleeping habits, as you're saying, the mood. So everything has its own part.
Yes.
Miss Washington says, I'm aware of the date my phantom symptoms, so I always stay aware. Every
That's
woman is different to agree. I need to start that. And yeah. And I think I have enough planners
good.
to
Yeah.
start that section as well. December 2020, I got stage 4 breast cancer. My 17-year-old daughter felt a lump. Can she get breast cancer at that age?
I mean, I'm not going to say no, she can't, because there is no definite like, oh, you're too young for this, you're too young for that.
But she can get tested, correct?
Yes, she can definitely, she should have an appointment with her doctor to have that assessed even further. And from there, from her doctor, there should be a referral made for a specialist so that she can be assessed to see if this lump is just normal fatty tissue, if it's a change during her cycle, because some women, they say that our breast tissue can become more dense before our
Mm-hmm.
cycle. And so it feels a little odd to us, but if you're paying attention, but you know your
Yeah.
body, you
Right.
you know, all right, this is normal, this is not. So definitely make an appointment, but I would say she's not too young
Mm.
because it can happen at any age.
I know also discharge isn't. We're not only talking about discharge from your private area. There's discharge from your breast.
Yeah, some women do get discharged from their breast, and that is also something that needs to be paid attention to. I've really only heard it happen more to women who've already experienced pregnancy and childbirth. But it's not to say that it can't happen to
Mm-hmm.
women who haven't experienced that, but you still want to keep an eye on it.
Right.
So if you notice there's a little discharge there or there's a little extra crust there because skin sheds, um, definitely get it checked out.
Okay. Hormones, we have different part during different times of our cycle. Guys don't. I definitely keep track now. I didn't want to go on hormones. If I have drastic changes, the doctor said she might put me on hormones. Can wearing a bra to sleep cause it?
I
Cause what?
I think Melissa's asking about the lump. I honestly don't know. They say
Mm.
it's best to not wear a bra to sleep, technically. And I know some people are probably going to come for me like, oh my God, I can't believe you said that. But really and truly, women aren't supposed to be wearing bras.
Look here. Oh,
Okay. And also,
I experienced the Medea syndrome, where when I take that bad boy off and I lay down, you got heavenly people here, the bountifulness. It'll slap you. It'll choke you. You got to be careful. If you want, wear a sports bra. But
yes.
I'm not doing that. I free Willy and Wilhelmina because that's too restricted for me. I need to be free. So then I just learned that, tops and bottoms should be free. Now, from talking to you the last live we had, I
Hmm.
mean, it might develop other situations with your partner, might get them excited, but I'm just saying, I'm learning. I'm learning about myself and how to treat myself. So, they in Jamaica, they said, let things be free.
Right.
So it's best to do that. Yes, my mom had discharge from her breast and went to the doctor and they found breast cancer. So I get mammograms earlier than others because she had breast cancer. Yes, girl, my daughter does. Right. So it's important I didn't know how important it was. I used to think that was just for old people. I'm gonna be honest.
Right.
When
Me
I get
too.
older, I'll do all that stuff. I ain't gonna do none of that stuff now. But wow.
Yeah. We
If
learn now it's better to keep it free because it needs to breathe.
right.
And an analogy that came to me after I left, and I was like, I really thought of that. The same way how we wear a mask now because of everything going on, and we feel restricted and we can't, well, most of us can't breathe as freely and easily with the mask on. Imagine what your vagina feels like wearing these panties all day long, 24/7. It can't breathe and it needs to breathe.
My girl said the VJJ needs to breathe. So your VJJs is out there screaming, let me breathe. They're
Yep.
gonna have signs soon talking about weird people too. So
Yep.
y'all need to take care of yourself. So we had started off by talking about douching.
Yes. Douching. The number one no, do not douche. We are not supposed to be sticking a water bottle up there to flush it out. That is just, I would really like to know who decided and said women need to flush out their vagina. I feel like it should be clean. Yes, we clean our outer part of our body, but please remember, and when I say vagina, I'm actually talking about what would also be referred to as a birth canal.
Okay.
It alone. Okay. Do not put a douche up there. Stay away from Massengill, which I don't even think they're making that anymore because I went to the
I
store,
haven't seen that in a while.
seen it. But Vagisil, no,
Okay.
Vagisil makes a douche, but Summer's Eve is still out here producing them. Please don't do it. It's not good.
Okay, so when you're thinking of using those things, because you would think they were cleaning you, they're not. They're harming you instead.
Actually, doing more harm than good. They're not doing it, honestly. So the woman's vagina, and this is for cisgendered women, the ones who are biologically born with them, because I cannot talk on
Yeah.
the surgically created ones. I have no
Mhm.
idea what's on with them.
Okay.
Our vaginas, it's an acidic state. It's made to be protective of itself. And so when you introduce a douche, what you're doing essentially is flushing away its natural protective layers.
Okay.
You know, the lubrication that we naturally have and the bacteria that lives there, that is there to protect it as much as possible.
Okay.
So use a douche, now you're opening yourself up to being more prone to yeast infections, bacterial vaginosis, sexually transmitted infections, things like that. And please, I mean, I want to say a lot of us, by the time we reach our mid-30s, we may have experienced a yeast infection, how uncomfortable that is, because again, we didn't know any better between wearing tight clothing
Right.
or
Right. Right.
it's uncomfortable. So
Right.
why are we still opening ourselves up to
Okay. We got another statement. I've been having breast exam since 12. I have a knot on my areola since 12. My grandmother was on it. Um, Kate says, "Plan our hobbies will get excited if they knew that." I know, Kate. I'm going there right now. Probably. Good afternoon, Cindy. That's a new thing that starts a new problem. I'm going to ask another question here. What about the adjutants? I don't even know if I said that word. When women use oils or creams or lubricants.
Did you say pearls first? You kind of broke up for me on my end.
No,
Did you say?
pearl.
Oh,
No.
okay.
I say
That
nothing about pearl. I ain't say nothing about pearl. I ain't say nothing about pearl. I don't know nothing about pearl.
not pearl, but pearls. No.
I was trying to say adjectives. Like you use lubricants, to get that area moist and stuff like that. Is that harming or hurting?
It's not harming if you're using the correct type. So you should be using, if you're using a lubricant, it should be water-based. So that's your cake jelly. Sometimes you'll see it at the emergency room if you have to go there, or the doctor's office, and it's just labeled in a little tiny packet. And I don't think I have any.
So hold on, you telling us to go to the emergency room and get the packets?
No, if you go to the emergency room, stay out the cabinets. Don't be like me raiding the cabinets. Stay out. Yes,
hold on. I almost have me going to the ER real quick. I'm just gonna check the stash. Because okay, so let's express that. So some women use those lubricants because of that area. This is a tough subject. Gets dry.
That is because of hormonal changes. So the women more prone to dryness are postmenopausal women. So you now have a decrease in estrogen and these because of menopause and the end of our whole reproductive cycle, or ending, I should say. And so now your body's like, well, we don't really need to make all this lubricant, because what are we getting lubed up for? Nothing, but in actuality, you get a little irritated. So it just happens. So you need to make sure you're using a water-based lubricant, please. No Vaselines.
No Vaseline.
Please, no.
No lotion.
No,
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 no, none of those products that's close to the bed,
no.
like
Oh,
aloe vera and some
that
gel. And
aloe vera. Aloe vera is one that I'm looking into
oh,
to see exactly how safe it can be used.
no cocoa butter.
No cocoa butter. However, you can use coconut oil.
So you can go in the kitchen and get the coconut oil.
You can go and get the virgin pressed coconut oil. It has to be the virgin.
Okay,
100% natural.
so you got to
And
get a virgin. Somebody said baby powder. What the hell?
yeah, you'd be surprised all that we can use coconut oil for besides cooking.
Okay, baby powder.
No, no.
Well,
I
it
don't.
said baby power, but I think that's what she meant to say, baby powder.
Oh, okay. I see the baby powder. Yes, the baby
Yes.
powder. Listen.
Okay. Um. Wow. These are some things that I think this is a great discussion. If you're just tuning in, we are talking about products that we use as women for our bodies and we shouldn't use. This is Pine and Ginger. I can't say her name right. Sayo
It's on. I don't know why Diamond's still in.
That's why I said Pine and Ginger. I didn't want to mess it up. This is Wellness Wednesday. We're talking about health and talking about products that we should and should not use. And as I said, disclaimer, these are just our opinions. She is a registered nurse, and she's only speaking from the experiences that she has had or known of. And yeah, so please, disclaimer, don't. It's best for you to get your own opinion and whatever advice from your doctors or your OBGYN. In the comments as well, put some questions in there that you might have that you want to ask, that you've never been able to ask before. This is the platform. We are a no judgment platform. We are just trying to educate and edify you on doing good for your body. Okay, so while we're here, what about tampons? I had a phobia when I was growing up. There's like, you don't want to put, I think my church people was trying to scare us. Don't push that thing up in there because
the church people, they will give you phobias about everything.
my church was good. No offense, anybody church watching. I love you, my church. Yeah, but I'm just telling y'all what y'all did to me.
Tampons are safe to a certain extent. And I'm glad you brought up tampons because it also kind of it does correlate with pads as well. When using those products for your menstrual cycle, you want to make sure that it's 100% natural. So you're not, and trust me, please, I know we have all been brought up on Kotex, Tampax, Always, Playtex, but those brands really and truly were not and have not been for the longest time safe for us because there's so many unknown chemicals that they use in processing to create
We gotta
them.
look for organic tampons.
Yes.
PG, wait a minute. Hold the hell on. Hold on. No. So I'm gonna go in the store and look like just when I'm going in the grocery store, I avoid the organic vegetables because it's more expensive. So it's biodegradable, like it's gonna disintegrate in me. I don't gotta take it out.
I'm going to disintegrate. No. Thank you. No, please, no.
Somebody in the chats was thinking that they didn't want to say it, but I said it.
Right. So there is always somebody thinking something.
Somebody thinking something.
And there has to be a person to come out and say it. And thank you.
That's it. Bam.
You can use tampons. However, with any tampon, you still run the risk of TSS, which is toxic shock syndrome. Say that 10 times.
JJ in shock.
Yeah. So what it is that because really and truly when we're on our periods, or your menstrual cycle, whatever you choose to call it, that blood is supposed to flow out. It's really not supposed to stay backed up in us. And when you introduce a tampon and we can get busy, life gets busy, and the next thing you know, you kind of forgot that it's there, you run the risk of causing bacterial growth.
I'm sorry, you said that you forget the tampon in there?
You'd be surprised how many women forget a tampon is in them.
I'm gonna hold that thought. I'm gonna just let you keep talking because someone's asking about besides soap and water, what else can we use for summer's eve when you use summer's eve powder? Go ahead, keep going.
I'm gonna get to that summer's eve in a second.
Okay.
So with so toxic shock syndrome is the accumulation of the bacteria that should have been flowing out, but it's been staying in your body, and now it gets the chance to travel up where it doesn't belong, so it can travel through your fallopian tubes into your ovaries and cause.
Oh, stop! Wait a minute. You gave me a vision. You mean that cardboard section part can go up somewhere?
No, the bacteria. No,
Oh.
no. You have your cervix stops.
Okay.
It's from mostly going up.
Mm.
But bacteria is small enough to travel through. And then that's where you have pelvic inflammatory disease, PI.
Okay.
That
So
can
that happen like when people still have sex on their period?
No, having sex on your period is perfectly fine.
Excuse me?
Yeah.
What?
No.
You'd be surprised how people are out there doing it, but they don't want to say it because
I'm sorry. Hold on. That's a lot. There's a lot of busyness going on. It's too busy. It's like it's out of service at that time for me growing up. We don't mess with people like that when it's not that time. That might be great for y'all, but this girl right here, well, I don't got no excuse no more because I don't have that no more. But I just thought that was crazy.
Yeah, because we're taught to think that way. Because when you think about it, going back to when we're growing up and stuff like that, and a lot of cultures, a girl's cycle is taboo.
Right.
A girl's cycle is, oh my God, don't touch her.
Right.
Stay away from her. Give her space.
Right.
For 5 to 10 days, depending on. Just leave her.
Yeah,
and it's like,
right. Yep.
It's so nasty. You're dirty.
Yeah.
And it's stuck in your head while you're going through, like, oh my God, I'm so dirty. And, when you're in a relationship, then you're like, oh my God, I don't even want my partner to be around me. Right now, I just feel gross. And it's like, well, why do you feel gross?
Because it's messy. I ain't gonna clean them sheets, especially if you like white sheets. Oh, it looked like a crime scene. I'm sorry. Let's just keep going. Let's just keep going. Ooh, Jesus, help me today, God, Lord. Let's go. Let's keep going. The question was, yes, water-based is best. Okay. That's not what. Besides soap and water, what can we use? What can we use? Summer's eve. Just answer the question.
In my opinion, you can take my opinion and do whatever you want with it. Just don't kind of blow it out of proportion, but stay away from Summer's Eve.
Okay.
Eve is just here to make money off of women. They're not really looking out for her.
This is her opinion. I don't know. Summer's Eve, don't come for me and don't ask me if y'all want to sponsor me. I can.
Yeah, so Summer's Eve, if you want to sponsor Diamond and put some coins in her pocket, please, by all means, do so.
Yeah, I don't need the product because I don't got none of that stuff.
You come to me, Summer's Eve.
Right. Do they still make OB tampons? I think they were made of cotton.
Yes. And the thing is, but see, this is the thing. All pads, no, I'm sorry. Retract that. All tampons are made of cotton. However, it's the process of how is the cotton being treated, cleaned, all of that, and being prepared to become a tampon.
Oh, wow.
If it's being run through all these chemicals and chlorine-filled bleach, and then they're adding formaldehyde and fragrance, and there might be a little dye somewhere in the process, none of that is good. And so you're now taking a toxic piece of a product that was told to us, like, well, you need to use it, and you're now putting it inside of yourself, and you're unaware of what could be causing
you to have those issues
happen. Yeah.
So it can contribute.
Right. So used to seeing the commercials for always Tampax, Playtex. They put them in pretty packaging with all the girly colors, the feminine colors, make us be like, oh yes, we want to buy that. But it's really a matter of, is it safe? So then now we have organic companies that none of their stuff is even processed with chemicals anywhere. So there's no no chances of any trace chemicals coming into contact with the products. And they don't get as much shine as they
Oh,
should because, they're not being promoted like that, but they're actually better for it. So one brand is L, and that is sold in Target. I found it in Target about 4 years ago, probably.
I
I
think
want to.
I've heard of it. I think I saw a commercial. Is it black owned?
L is not black owned, but it is POC owned.
Excuse me?
POC, person of color.
Okay. Okay, thank you. Oh,
Yeah.
she's speaking in tongues.
Lisa started that way. Um, but then the P&G brand conglomerate has bought it, and that is why we're now getting it into more markets. However, the L brand has a very good
I've seen that. I've seen that though in Target. I've seen even a commercial for it.
So what a lot of people will notice when you do switch from your regular always Kotex, whatever else they selling out here, to the organic ones, you're going to notice like, well, when I'm on my cycle, there's no smell now. Now
wow.
Because the dyes and the perfumes and the chemicals are not there to disturb anything and create this, what I call horrific smell. Like it was just like, oh my God, I can smell that. No, it's no longer there. What we should be smelling like when we're on our period, if anything, is metallic because of the blood. So
Metallic.
blood.
Okay.
So if you're smelling anything else more than that, you should be looking to see like, do I have an underlying infection going on here, or is it my products? And so when just make like notes, keep track of like the changes in your body, because a lot of women say, oh, well, I have such excruciating cramps, and that used to be me back in the day.
Right.
Labor pains. And it was like, why do I have these cramps? Why do I feel like this? And when I switched over to the natural and organic, that went away. Like,
okay. That you just opened up another. I don't want to forget what I'm about to ask you, but I don't want to miss anybody's question or statement. Thank you guys for joining. There's 21 of us watching right now, and I appreciate every one of you. Kate said I switched to organic pads now. I signed up for reusable pads. I got a question about that. Don says I had a total hysterectomy when I was in my early 30s and was thrown into menopause, and I'm still having the sweets and moodiness, and I am 50 now. I'm in my 50s now. How long can this last?
wow, that's a long time. Probably forever, until your body starts to say like,
Ask your doctor, Dawn, because I don't want her telling you forever and then forever ever. We don't. It depends. The Lord might remove it just because you asked the question today. I looked at my question. I want to ask, how long does the hot flashes last? I'm 54. I started at 45. Wow.
Ooh, the hot flashes can last for as long as you're going through menopause, and menopause can take a long time. So
you can't turn it off.
No, you yourself can't turn it off. No, you just have to ride the waves.
Just buy them Chinese fans, baby, and just have them in your bag, in your car, have them wherever you can. Because I saw a lady in church Sunday. She was ushering. Next thing you know, she had to come out and let this happen because they didn't understand. You thought it was hell on earth. So yeah. Okay. Question: the reusable pads?
Yes, there are reusable pads. Period underwear now.
What do you mean by reuse? I know it's disposable.
We know disposable. However, and you know what? This just reminded me. I forgot to. I really meant to bring the books to show that I was given to learn.
Okay.
But there are disposable pads. I mean, reusable pads now. And I think that actually may have started a long time ago, before we were around, because when you think about it, back then, nothing was really disposable. So, and this is a time of when they had the belt that women used to wear with a
pad up. Yeah.
In place.
Yeah. Strap on. I mean, sorry.
And
look
And so the same with like reusable diapers for babies. There were reusable pads for women. And then once we got into the whole age of disposables, that was like far gone. And so now it's making a comeback. Um, to each their own. If you want to use it, you want to try it. I'm not there yet.
Because I've
But yeah,
seen advertisement for that too, where they, is wash it and then put.
so what I've seen them say is when when you use it to kind of rinse it,
Yeah, I'm good.
then put it in the machine. But and I
Okay.
and still
Everybody
be
different. Everybody, what floats your boat, let your boat float on.
yeah,
That's my opinion on that.
yeah. What is it called? The Think, which is the period underwear, which is rewearable. Like I said before in the last live, I'm just not there yet with that because for one, with regular underwear, my butt swallows everything, so I just don't fancy it. Uh, wearing that because
Hey, Karen.
so if my butt swallows that, then
Okay.
I'm
So yeah,
for
we talking about thongs and stuff at that time.
regular underwear turns into thongs for me all the time. Like I
Oh
just can't.
wow. That's because she's bountifully blessed in that area down there. Okay, behind her. I was gonna ask another question, but here's Yoli's. Can we talk non-intimate causes UTIs? I keep my woo-ha clean and drink a considerable amount of water, and yet I have UTI, and my ketosis and protein are abnormal.
Okay, so there's a lot of different parts in that one question, and
Yeah.
thank you.
She continued, and I found out I have to have a biannual iron cocktail, monthly B12 injection, and 3 times the amount of vitamin D because of my gastric bypass I had. Ooh, Yoli.
So that's heavy. But I'm glad, Miss Yoli, that excuse me, you asked that. So I'm just trying to figure out where we're gonna pick. So yes, you can get a UTI without having sex. You can get it without it
Where we
being
get it from?
um so this is the thing, and UTIs happen. They say it's very common for us nurses because we're so used to holding our bladders for hours on end, which is not,
Okay.
so that can happen that way. Also, if the normal bacterial flora is disturbed, and your pH balance is off, you can then reintroduce some bacteria to your urethral tract.
Oh,
And
so there's many different ways that it can happen. It doesn't only happen by sex.
no, no,
Okay.
definitely no. It's so if anyone's thinking like, oh, she got a UTI because she's been having messy sex or something, false, completely false. Anyone and everyone can get a UTI. Men get UTIs. So
Yeah.
it's not just stuck to one particular situation. If your flora is off, you can be drinking plenty of water and still get it. Absolutely. Not wiping correctly when you go to the restroom. Absolutely. Definitely
So
100%.
there's different country.
Contribution.
Yeah.
Yeah.
All these big words I can't use. I don't know if we hit all the answers to the question. What about using toys?
When it comes to using sex toys,
These are some good questions.
toys, and I love these questions. Thank you. Um, One thing you always want to make sure is that you're being clean about it. So
You and the toys.
yes,
Okay.
because the same way we would take a shower sometimes before we get intimate with our partner, you're supposed to be taking a shower to get intimate with yourself, or if you're using your toys with them too. Okay. But you want to make sure it's clean. So when you get the toy and it's new, you still want to make sure that you clean it. And I suggest when you're cleaning it, you use your same whatever you use to wash your hoo-ha as we've seen. You can still use that too as well to clean, thoroughly dry
But not
it.
the chemicals that come with the toys.
What chemicals? There should be no chemicals coming.
No, sometimes they sell sprays for the toys to clean the. That's why I asked the question. First of all of y'all in the chat room looking at me crazy. I'm asking questions that someone submitted to me. It could be me, but I'm just saying I'm asking the questions that y'all ain't asking. Don't come for me. We moving on. We grown folk over here.
This is definitely a grown conversation.
Okay. But it's serious because people want to know because they're scared to ask.
And I really wish people were not scared to ask these questions, because you can avoid so many potential problems just by asking questions and getting the answers. So they do have antibacterial sprays that they sell to go along with your toys. But I still suggest that even after you use that, still wash it and let it thoroughly. Because you don't want to have any bacterial growth that's there. And you can't see it. And then
right.
You're having fun. And sometimes it can happen like the next day. By the next day, you're feeling.
Right.
So make sure when it comes to your toys, you're storing them properly. So some people use a silk bag. But I don't suggest people throwing it like into their drawers. Not drawers, but drawers.
I get what you mean. Don't throw it back in your when you finish with it, throw it back in the drawer, hide it because the kids coming. No, clean it and clean yourself. Also, it's true that after sex that women should pee.
Yes, very important. Just because things happen, you also have someone else's bacteria now in your body or on your body, and within you, depending on what you chose to do. And
so if you stand up having sex, that ain't helping the stuff drop out.
No, ma'am. No, ma'am. No. Still for you, and that's for everyone. Even if you've been with your partner for 10 years, you're married, you're now like 85 years old.
If we stand up, we don't got to clean up real quick.
Still have to urinate because and another thing too is, and if people aren't aware of it, urine is actually sterile until you urinate.
It depends on whose urine it is, girl.
Yeah.
Well, no, borrow somebody else's urine to go take a drug test. It ain't that sterile. Cause now this guy done borrow somebody's urine. He found out he pregnant.
And it happens. It's like, how are you gonna explain this? Like,
okay, I'm sorry. Yoli still was saying maybe I should stop using the wipes because the wiping is right, but I always use wipes after.
And it's perfectly fine to use wipes. However, make sure it's from a brand that is geared towards feminine health. So your Vagisil and your Summer's Eve wipes, don't do them.
What about using feminine wipes?
Yeah, those are the ones.
Okay.
Those, no, because it's still
wipes don't make a difference.
Feminine wipes can actually harm you. And from my own personal experience, the last time I used a Summer's Eve feminine wipe, which was labeled sensitive skin, it burned. And I was like, whoa. So I just threw them all out. I was like, I want no parts of this. And it shouldn't be that way. So just make sure that, it's hypoallergenic. It's geared towards the pH of a woman's body, because like I said, it's an acidic area, so you don't want anything throwing it off. And you can even make your own at home.
There's gonna be a DIY. That's gonna be something else. We're gonna do another show with that one because, girl, everybody trying to save $1. If we can make our own wipes, I've seen Clorox wipes being made with bleach and in a Ziploc bag, so it's possible. What about using the okay, that was the last question. I have one more question. Toilet paper. Some people have sensitivity to certain toilet papers. Because you might wonder why you're having massive lower pains and cramps. I know specifically me, I have to use certain type of toilet paper. Some I can't mess with. I'm very allergic. Right. What is it that like I'm gonna say Charmin is soft, but it's thicker. Two-ply, Scott's, those different name brands.
Since then, yes.
Why does that harm you? What is
For one, number one, again, back to how is it being processed to being turned from the cotton, natural cotton, into now toilet paper.
mhm.
Um, and some people's bodies are way more sensitive, so their bodies will pick up on even the tiniest bit of trace chemical and just throw them off. So you have to look at that. Also, when you do use them, is there any lint or remnants being left behind?
Wow. Okay. Okay.
And then you're,
Michelle.
what is this? Why is this here? No, no, we don't like it. And so it starts to attack. And then when it's unhappy, our vaginas will tell us. Our vaginas basically talk to us every
Right.
day.
Yeah, look here, bro. You bring Scott's up in here one more again. It's gonna be a misunderstanding. It's gonna be furniture moving.
Right. And you remember back in the day, you could get colored toilet paper and it would be scented?
No, we wasn't rich like that. We only got one. If we get two plywood, that was a sale.
Well, my aunt, may her sweet dear soul rest in peace. I remember back in the day when I would go visit her after we moved from New York, and we would go back, and I went to her bathroom and I was like, oh, she got pink toilet paper. And I would be like, oh yeah, I'm so happy. But
But to
actually
die.
it's died. And that's
Wow.
completely terrible. Like, you shouldn't be using that. I mean, so that's why nowadays you don't see it anymore.
Okay.
Blue toilet paper or pink toilet paper or yellow or green. It is completely done away with.
Okay.
We were not supposed to be using that in the first place.
Okay. This is interesting. I can't believe the time is gone. It's
What time?
2:10.
Yes.
It's 2:10. I think we had a great conversation. If you agree, put something in the comments and let us know. And I know this will be replayed. I don't know if I recorded it. I don't know if I pushed the button, but I just want to thank you so much for answering these questions. I hope they were helpful. She had blue and green. See, they do. Okay, I hope that what we said today was helpful to you or edifying. And if you have more questions, I advise you to go to your doctors and ask these questions. Don't be afraid.
Mm-hmm.
It's time for us to know our bodies or get to know ourselves and know what's better for us, because we could have been harming ourselves for a long time and have no idea. But now knowledge is power. And we as women need to know better for ourselves, to do better, to pass on to our children or to our families or to our loved ones so we can have a better world.
Right.
I think this was really good, and I thank you so much for
Thank
taking
you.
the time out. Maybe we can do this probably once a month or something, and checking back with our nurse, P&G. That would be great. Like, Wellness Wednesday is available. If you guys like that idea, put it in the chat and check out her channel. Do you have a YouTube, P&G?
Yes, it is Pine and Ginger Plans on YouTube. I have not been active on there for a long time, I know, but I am gonna be getting back to it. So no
Yes.
worries. Um,
Yes.
so on Instagram as well at Pine and Ginger Plans on Instagram as well. So if anyone feels the need to ask me a question in the DMs that you may not have been comfortable typing it in here, it's perfectly okay. Don't feel there is no stupid questions,
Right.
especially when it comes to the female body, because like I said, and we said, it is a learning process. I mean, you'll be learning about it forever. There's no cap on how much knowledge there is to it, because
Right.
it's even.
Every day you learn something different about yourself. So why not ask the questions? And I'm glad that we've made this platform available for everyone. Thank you so much. Thanks everyone that's here. Thank you for coming in. Thank you for participating. Even if you didn't say anything, I thank you because I see the numbers. And that's a wrap.
Yes, thank you everyone for your questions, and being open. I know it's not easy sometimes asking questions. It's
Right.
definitely, but I truly appreciate it, and stirring this. What is what do I want to say? Because honestly, I was getting ready to quit being a nurse. I was really thinking about it. Yes, with everything going on and all that, I was like, I don't really feel like doing this anymore. What? It's
So
so
then, so then
disrespectful.
I'm gonna stop you right there. What makes you go in and do the job, even in a time like this during the pandemic? What keeps you going?
it's just, I feel, what keeps me going? Well, for one, my late aunt who passed last year due to COVID in New York, because she had always been one of my biggest cheerleaders in the family. And when I became a nurse and I got licensed and everything, she was extremely ecstatic about it. And even to like I think a couple of months, she cut somebody out for trying to come and say like, "Oh, well, your niece is a nurse," and da. And she just went off on them. So she's one of the main reasons. And also, I don't know what else I would probably do with my life. It's like, you know what your calling is, and to see like you came out and reached out to me, or things keep coming and it's like, all right, well, this is where I'm supposed to be, this is what I'm supposed to do. And that's what just keeps me going. And it's just a matter of everyone bettering themselves. We're all on this long journey of life, and we have so much to learn and unlearn.
But
And
here's another question before I interrupt you. Are you scared?
am I scared of what?
Working in the nursing field now with this pandemic the way it is, how do you, I mean, to be human, how do you, I know you get scared at something, I mean, you have deep faith, but what I'm saying is, how do you not stereotype a person? You get what I'm saying? Like, oh my God, it's like this, it's not the C word to be cancer now, the C word is COVID.
Right. And you make a very good point with that. I think it's just naturally me. I'm more on the fearless side.
Huh.
So I'm always like, oh, let's just go do this. And everyone else may be like, oh, well, aren't you scared? I'm like, well, whatever. If it's gonna happen, it's gonna happen. We
All
don't
right,
know
it
unless.
is what it is.
And I'm your non-traditional nurse, so no, I'm not on an ICU floor. No, I'm not on a COVID unit. Yes, I am avoiding them.
Oh wow.
However, but my level of exposure to the what ifs, the unknowns, is still there when I show up to work. And honestly, I don't know. It's just in me. It's when you
Well, it's
sign up
because we
again,
need more people like you.
it's just you take an oath to do this job. And I mean, you do whatever you want with it. That's your business. But it's like I just know like this is what I signed up for. This is what I'm gonna show up for. It's just what I have to do. I don't even think about it.
Okay. Well,
So
listen, I'm going to tell you today, don't stop.
thank
Because even just today, you being knowledgeable and expressing and sharing it with us, you helped us.
thank
So
you.
we need you. Because if there weren't more people like you, we probably do better in the world. But if you don't go to work, then if I'm sick, I need help.
Yeah.
So I
Yeah.
want to tell you from the bottom of our heart, the DMP family, we appreciate you.
Thank
We
you.
thank you for getting up every day and going to work because we need you. You are essential. So
Thank you.
don't stop and don't question your purpose anymore. Know
Yeah.
that it is intentional.
And for everyone who's watching this now, watching the replay, when you show up to your doctor's office, and you see the nurse or the medical assistant, you know, even the receptionist, say thank you, because I've been in all three of those roles where I've just announced like I've been the nurse, the medical assistant before I became a nurse. Say thank you to them and show your appreciation with them, because
Yes.
it's a lot
Means a
for
lot. Yes.
for us to get up and show up,
Yes.
because you want to be home too, but
Right.
you don't have that choice all the times. And we're finding, trust me, we're finding a way to stay home. But still say thank you, and please remember everyone is still thinking of your health and why you're there. And it can get frustrating for everyone. Just try your best to stay as calm as possible and everything smoother, because normally it's a dangerous job to be a
Yeah.
nurse. A lot of times you're getting beat up by a patient or verbally abused by them, and it's not said, but now what's going on, the the incidences of it happening is rising. So
Yes.
everyone give grace. You know,
Yes.
no one
Yeah.
is out there trying to, well, let me take that back. There are some mean
Not
nurses,
everybody.
but not everyone is out here trying to be mean to you and make you suffer.
Right. Right. Thank you so much. Last comments. Everyone's saying thank you. And GWP, hey, what's up? Hey, PNG, I'm delayed on this discussion, but thanks for this conversation. Great topic. Thanks for all you do. You guys have a wonderful hump day. I engage and thank you all. Thank all of them from the moment I walk in, including the guard at the door. A simple "how are you" or "thank you" goes a long way for them. Thank you, thank you, thank you. So, guys, with that being said, well done. And I'll see you in the next one. Stay sticky, guys. Be safe.
Stay sticky.
Bye, guys. Thank you so much.
Bye. Thank you.